If you have topics you would like to have us discuss on the Aging Well podcast, please click on the links in the episode description to send us a text or record your message or comments. We'd love to hear from you and how we can help you age well. If you benefit from the Aging Well podcast and would like to support the content financially, please click on the Support the Show link or support our affiliates and advertisers. Welcome to the Aging Well podcast. I'm Jeff Armstrong here with Corbin Bruton. In this and the episodes that follow, we will share candid discussions on aging and hear from the experts. We are here to inform and encourage as we experience, aging. Recent research published in Neurology suggests that phosphodiesterase type 5 inhibitors, like the drug Sildenafil, prescribed for men with erectile dysfunction, may reduce the risk of Alzheimer's disease. In this episode, we discuss the benefits and limitations of PDE5 inhibitors for preventing dementia and aging well. Corbin, did you know that little blue pill might also prevent dementia?
Little blue? Do you mean Viagra?
A recent study in Neurology by Addison and others titled Phosphodiesterase type 5 inhibitors in men with erectile dysfunction and the risk of Alzheimer's disease suggests this is so.
Well, this sounds like an interesting topic for the Aging Well podcast. Why are they proposing this category for drug prevention of dementia?
Well, phosphodiesterase type 5 inhibitors, let's call them PDE5Is, are one of the most widely used drugs that have been repurposed.
Repurposed? Meaning they were originally developed for other treatment purposes?
Correct. The first PDE5I, Sildenafil, was originally developed for the treatment of hypertension and angina. The intended vasodilatory effects were also found to cause smooth muscle relaxation in the corpus cavernosum, making sildenafil an effective repurposed treatment option for erectile dysfunction, or ED.
So sildenafil is Viagra?
It is.
So why an ED drug to prevent dementia?
Good question. Personally, I'm not a fan of using any drug for preventative medicine.
I sense the air quotes around medicine.
And you are correct. The idea of treating what may not ever exist just rubs me the wrong way.
In your classes and on this podcast, you always suggest that the best prevention against most diseases is exercise. Eating a healthy diet, maintaining a healthy body composition, having good sleep hygiene, and
don't smoke.
And don't smoke. And the Klianskis from episodes 120 would also suggest limiting many classes of drugs to reduce the risk of all types of dementia.
They were particularly adamant about the use in adolescence when the brain is developing. No Mary Jane until after the age of 25.
No Mary Jane until after the age of 25. We need to have the Klianskis back regularly on this podcast.
We do.
So you would stand by these healthy lifestyle practices to prevent dementia?
Dementia is a complex disease. Recall from the Klianskis' book that it's sort of a Gordian knot. We know that exercise, eating a healthy diet, maintaining a healthy body composition, having good sleep hygiene, not smoking, and limiting the variety of drugs suggested by the doctors can reduce the risk of dementia and at least delay the onset and limit the symptoms. Simply taking ED drugs may have an effect. But let's look at how these drugs work.
Well, they're vasodilators.
And what else is a vasodilator?
Exercise?
Exactly. So ED drugs may reduce the risk of dementia, but
why prescribe a drug when one can reduce risk through healthy practices?
I see no reason, unless perhaps for someone unable to exercise.
For such people, what are the benefits of taking drugs like Viagra?
Drugs like Sildenafil or Viagra promote the relaxation of smooth muscle cells in blood vessel walls, leading to vasodilation and improved blood flow. Thus, they mimic exercise, which also induces vasodilation to improve blood flow to various tissues, including muscles and the brain. By enhancing vasodilation and increasing blood flow, drugs like sildenafil may improve circulation throughout the body. This enhanced circulation can improve more oxygen or deliver more oxygen and nutrients to tissues, promoting tissue health and function. Exercise has similar effects on circulation, albeit through different mechanisms. Some studies have suggested that sildenafil may improve exercise performance, particularly in individuals with certain conditions such as pulmonary hypertension or heart failure. By increasing blood flow to working muscles, sildenafil may help improve exercise capacity and endurance. There is some evidence to suggest that PDE5 inhibitors like sildenafil may have metabolic effects, including modulation of glucose and lipid metabolism. Exercise also influences metabolism, promoting glucose uptake by muscles and improving insulin sensitivity. While the mechanisms may differ, both sildenafil and exercise can have beneficial effects on metabolic health. As we've been discussing, there is an emerging research that suggests that PDE5 inhibitors like sildenafil may have neuroprotective effects, potentially by increasing levels of CGMP in the brain and promoting neurogenesis. This is like exercise, which is also known to have neuroprotective effects and can promote brain health through various mechanisms, including increased neuroplasticity and the release of neurotropic factors.
It's important to note that while drugs like sildenafil may share some similarities with exercise in terms of physiological effects, they do not provide the comprehensive health benefits associated with regular physical activity.
Exercise has a wide range of positive effects on overall health and well-being, including cardiovascular health, mental health, and longevity that cannot be fully replicated by medication alone. Additionally, sildenafil and similar drugs should only be used under medical supervision and for their intended purposes.
We've discussed in numerous episodes the benefits of regular exercise for aging well. We know the regular exercise has numerous benefits for both physical and mental health, and we have shared that it can significantly reduce the risk of dementia. Remind our listeners of the key benefits of exercise concerning the risk of dementia.
Exercise helps to improve cardiovascular health by strengthening the heart and increasing circulation. This in turn reduces the risk of conditions such as high blood pressure, heart disease, and stroke, which are all risk factors for dementia. Physical activity has also been shown to increase the production of neurotropic factors, such as brain-derived neurotropic factor, which promote the growth and survival of neurons. This can help maintain cognitive function and protect against neurodegeneration associated with dementia. Exercise has been found to stimulate neuroplasticity, the brain's ability to reorganize and form new neural connections. This can enhance cognitive function and potentially offset the cognitive decline associated with aging and dementia. Regular exercise is known to improve mood and reduce symptoms of stress, anxiety, and depression. Mental health issues such as depression are associated with an increased risk of dementia. So exercise may indirectly lower dementia risk by promoting good mental health. Exercise can improve the quality of sleep, which is essential for overall brain health. Adequate sleep is important for memory consolidation and cognitive function, and poor sleep has been associated with an increased risk of dementia. Exercise helps to control risk factors associated with dementia, such as obesity, diabetes, and high cholesterol levels. By maintaining a healthy weight and blood sugar levels, exercising regularly can reduce the risk of developing dementia. Some studies suggest that regular physical activity may delay the onset of dementia or slow its progression in individuals who are already experiencing cognitive decline.
So overall, the evidence strongly supports the idea that regular exercise is beneficial for brain health and can help reduce the risk of dementia. It's important, however, to note that while exercise can significantly lower the risk, it cannot guarantee complete prevention, as dementia is influenced by a combination of genetic, environmental, and lifestyle factors.
And if drugs like Viagra are prescribed for ED, they may have benefits that may contribute to the reduced risk of dementia.
What are the risks associated with PDE5 inhibitors?
PDE5 inhibitors, including the drugs like sildenafil, as Viagra, have been generally considered safe when prescribed for the treatment of erectile dysfunction and other medical conditions. However, like any medicine, they carry potential risks and side effects. PDE5 inhibitors can cause temporary decrease in blood pressure, particularly when taken with other medications that also lower blood pressure, or when taken by individuals with underlying cardiovascular conditions. This can lead to symptoms such as dizziness, lightheadedness, fainting, or even more serious cardiovascular events, especially in individuals with pre-existing heart disease. PDE5 inhibitors can interact with certain medications, particularly nitrates, such as nitroglycerin, used in the treatment of chest pain or other heart conditions. Combining PDE5 inhibitors with nitrates can cause a dangerous drop in blood pressure. Some individuals may experience visual disturbances, such as changes in color vision or blurred vision when taking PDE5 inhibitors. Priapism is a rare and serious side effect of PDE5 inhibitors characterized by prolonged and painful erection lasting more than 4 hours. The most common side effects of PDE5 inhibitors include headache, facial flushing, nasal congestion, indigestion, and muscle aches. These side effects are usually mild to moderate in severity and often resolve on their own over time. Although rare, some individuals may experience allergic reactions to PDE5 inhibitors, characterized by symptoms such as a rash, itching, swelling of the face or throat, or difficulty breathing. PDE5 inhibitors like Sildenafil are sometimes misused or abused for recreational purposes or to enhance sexual performance. Misuse of these medications can lead to serious health consequences, including cardiovascular events, priapism, or interactions with other substances.
So with sildenafil being a vasodilator, what are your thoughts as an exercise scientist? What are your thoughts on other vasodilators such as L-arginine or L-citrulline with that nitric oxide boost?
Well, be the same thing. Exercise is going to do that for you. Personally, I don't see any reason to be taking any of those. And, we've talked about our list of supplements in the past. I think they can have some benefit. And I think, again, it's like a self-prescribing when it comes to taking something like Viagra, whether it's to improve sexual performance or whatever. From an exercising standpoint, it's going to increase vasodilation. For bodybuilders, they tend to get a little bit more of a pump out of it. I don't know that it's really not necessary what benefits you're going to get from it other than that added pump. But it's important to realize that physiologically, our bodies adapt to the circumstances. And so if we are exercising, we are naturally releasing nitric oxide and natural vasodilators that are going to increase blood flow to the tissue. So it may actually, exercise itself may have a positive benefit toward erectile dysfunction and just general circulation. We know it has a benefit toward general circulation. But again, erectile dysfunction is a very critical condition in many men, and it may need medical prescription in order to be able to deal with it. Exercise can have a benefit, but it's going to have its benefits taking the drug. And those drugs then can just simply have an additional side effect in terms of benefiting in reducing the risk of dementia.
Couldn't there be a more natural way, though? Because I know there's a lot of literature out there that says like pomegranate juice is a natural vasodilator. Wouldn't that be a more natural way to get? Wouldn't that be a more natural approach versus taking an actual drug?
For what?
Just vasodilation in general.
Okay, well, again, exercise itself is going to treat that. So whether you're taking pomegranate juice, you're taking, whatever you might be taking food-wise, yes, it's a vasodilator. It's going to help reduce blood pressure. But we go back to those same risk factors. If you're taking those to increase vasodilation, you're going to see a drop in blood pressure. So if you have low blood pressure or you're on blood pressure medications, those are all going to have an effect of further lowering your blood pressure, which might lower it to dangerous levels. So you have to be very careful taking even natural substances for the purpose of something that your body does on its own. And from the standpoint of taking those for erectile dysfunction, again, I would defer to a medical professional because they're treating a medical condition. They're the one prescribing it. As my grandfather would say, I'm a doctor, but I'm not a real doctor because I can't prescribe medication. I think there may be health benefits to consuming those things, but again, we have to be careful in terms of self-medicating and realize that all of that stuff is going to have a minor effect that probably pales in comparison to what our bodies can naturally do.
And I think with the vasodilation throughout the body, especially with exercise, bringing that blood flow, is more importantly, bringing the oxygen throughout the body, especially to the brain. That's what the literature is kind of talking about as far as not necessarily preventing dementia, but at least delaying it. And I believe that's what the Klinowskis also talked about as far as sleep apnea, making sure you're getting enough oxygen in total. Would you agree with that?
Well, yeah, of course I agree with that.
Okay. What are the side effects of exercise?
Common side effects of exercise include reduced body fat, increased muscle, improved cardiovascular function, increased strength, improved mood, improved social interaction. Need I continue?
Yeah, no, I think our listeners get the point. I think the real take-home message for this episode is that drugs should not be the go-to for preventing dementia. It's better to make the lifestyle change that benefits one's overall health. Don't smoke, exercise, and get plenty of physical activity. Eat a healthy diet like the Mediterranean diet. Maintain a healthy body composition and have consistent quality sleep habits. Do these things and you'll be healthier, limit the risk of dementia, as well as other diseases, and of course, age well.
Age well. Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.